Imagine a life constantly on guard, where trust is a luxury rarely afforded. This is the reality for individuals living with paranoid personality disorder, or PPD. PPD affects how people perceive the world and interact with others. It casts a long shadow of suspicion, making it challenging to form and maintain relationships. People with PPD often see threats where none exist. They struggle to believe in the good intentions of others. Despite the challenges, it's important to remember that PPD is a treatable condition. With proper support, individuals with PPD can learn to manage their symptoms and build meaningful lives. Paranoid personality disorder is characterized by a persistent pattern of distrust and suspicion. People with PPD have a hard time believing that others have good intentions. They assume the worst in people, even without any evidence to support their beliefs. This distrust colors their perception of the world, making it difficult to navigate social situations without feeling threatened or attacked. The world, through the lens of PPD, appears hostile and unforgiving. Everyday interactions become fraught with anxiety and fear. Individuals with PPD are constantly on edge, anticipating betrayal or harm from those around them. This heightened state of alertness can be emotionally draining. The core belief driving this pattern of thinking is that others are inherently untrustworthy. One of the hallmark symptoms of PPD is the tendency to misinterpret the intentions and motives of others. Individuals with this disorder often struggle to take statements or actions at face value. They search for hidden meanings and ulterior motives even when none exist. This can lead to misunderstandings and conflicts in relationships, as their interpretations are often based on assumptions rather than reality. For example, a simple compliment might be perceived as insincere flattery or a subtle attempt at manipulation. A casual remark about their appearance might be interpreted as a deliberate insult. These misinterpretations stem from their underlying belief that others are trying to deceive or take advantage of them. This pattern of thinking can create a self-fulfilling prophecy. By assuming the worst in others, individuals with PPD may inadvertently provoke negative reactions that confirm their suspicions. The exact causes of paranoid personality disorder are complex and not yet fully understood. Like many mental health conditions, PPD likely develops from a combination of genetic predispositions and environmental factors. Researchers believe that both nature and nurture play a role in shaping an individual's vulnerability to developing this disorder. Genetics may create a biological predisposition towards suspiciousness and distrust. Studies have shown that PPD tends to run in families, suggesting a hereditary component. However, having a genetic predisposition does not guarantee that someone will develop PPD. Environmental factors, particularly those experienced during childhood, also play a significant role. Early experiences of trauma, abuse, or neglect can have a profound impact on a child's developing brain. These adverse experiences can create a sense of vulnerability and distrust in the world, setting the stage for the development of paranoid personality traits later in life. The development of paranoid personality disorder is a complex interplay between genetic predispositions and environmental influences. It's not a simple case of nature versus nurture, but rather a delicate dance between the two. Genetics might load the seesaw, making someone more vulnerable. Certain genes might influence brain development and function, impacting how individuals perceive and respond to threats. This genetic predisposition could make them more sensitive to negative social cues or more likely to interpret ambiguous situations as hostile. However, it's the environment that often tips the balance. Early childhood experiences, particularly those involving trauma, abuse, or neglect, can act as a catalyst, triggering the expression of these genetic vulnerabilities. Repeated exposure to betrayal, manipulation, or hostility can shape a child's developing brain, making them more likely to view the world as a dangerous and untrustworthy place. This interplay highlights the importance of considering both biological and environmental factors when trying to understand and treat PPD. Childhood trauma can leave invisible scars that run deep, impacting an individual's emotional and psychological well-being long into adulthood. For individuals who develop paranoid personality disorder, these scars often manifest as a pervasive sense of distrust and suspicion towards others. Early experiences of abuse, neglect, or witnessing violence can shatter a child's sense of safety and security, making it difficult to trust in the goodness of others. This early betrayal of trust can have a profound impact on the developing brain, shaping how they perceive and interact with the world. The child learns to be constantly on guard, anticipating threats and searching for signs of danger. This hypervigilance, while necessary for survival in a dangerous environment, can become maladaptive in adulthood, leading to social isolation, relationship problems, and difficulty functioning in everyday life. Understanding the profound impact of childhood trauma is crucial for providing effective treatment for PPD. Treating paranoid personality disorder, or PPD, presents unique challenges for both the individual seeking help and the mental health professional providing it. The very nature of PPD, characterized by deep-seated distrust and suspicion, can make it difficult to establish the therapeutic alliance necessary for effective treatment. Individuals with PPD might be reluctant to open up to a therapist, fearing that their vulnerabilities will be used against them. Building trust takes time and patience. Therapists need to be empathetic and non-judgmental, creating a safe space for individuals with PPD to explore their thoughts and feelings without fear of criticism. Even with the most skilled and compassionate therapist, progress can be slow. Individuals with PPD might misinterpret the therapist's words or actions, viewing them through the lens of their own paranoia. Despite these challenges, treatment for PPD is possible and can significantly improve the quality of life for individuals with this disorder. Psychotherapy, particularly a type called cognitive behavioral therapy, or CBT, has emerged as a promising treatment approach for paranoid personality disorder, PPD. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to paranoia. It provides individuals with PPD with practical tools and strategies to challenge their distrustful thoughts and develop healthier coping mechanisms. One of the primary goals of CBT for PPD is to help individuals identify their automatic thoughts, those immediate, often unconscious thoughts that occur in response to a situation. Through CBT, individuals learn to recognize these automatic thoughts and challenge their validity. They learn to look for evidence that supports or contradicts their suspicions, rather than jumping to conclusions based on fear and assumptions. While psychotherapy is considered the cornerstone of treatment for paranoid personality disorder, medications can also play a role in managing symptoms and improving overall well-being. Antipsychotic medications, particularly low doses of atypical antipsychotics, might be prescribed to help reduce the severity of paranoia, delusions, and other psychotic-like symptoms that can sometimes accompany PPD. It's important to note that medications are not a cure for PPD. They primarily address the symptoms, not the underlying causes of the disorder. In addition to therapy and medication, building a strong support system is crucial for individuals with PPD. Having a supportive network can provide a sense of security and validation, helping individuals with PPD feel less alone in their struggles. Living with paranoid personality disorder can be incredibly challenging, but it's essential to remember that there is hope. PPD is a treatable condition, and with the right support and treatment, individuals can learn to manage their symptoms and live fulfilling lives. Recovery from PPD is not about eradicating suspicion altogether, but rather about learning to manage it in a way that allows for healthy relationships and a sense of peace and well-being. Through therapy, individuals with PPD can develop the skills to challenge their negative thoughts, manage their anxiety, and build healthier coping mechanisms. They can learn to trust their own judgment and to approach social situations with more confidence and less fear. With ongoing support, self-compassion, and a commitment to recovery, individuals with PPD can overcome the challenges of their condition and create a brighter future for themselves. Remember, recovery is not a destination but a journey that, while challenging, can lead to a richer, more meaningful life. Please like the video and share it with others. It can help someone who is suffering. Thank you for watching.